Hello everyone. Welcome to your Integumentary and Wound lecture. This is one of 3 lectures for your Integumentary module. Key terms in the PowerPoint are noted in yellow text. A study worksheet for note-taking and downloadable PowerPoint are also available in the Canvas module under the video link. So the learning objectives we will be covering today are 1. Explain the anatomy of skin and factors affecting skin integrity. 2. Discuss the processes involved in wound healing. 3. Identify factors that affect wound healing. 4. Identify different types of wounds and expected assessment data related to each type. 5. Identify and list nursing interventions for patients with skin disorders, including fungal infections. 6. Explain educational interventions for patients and caregivers. And 7. Discuss the psychological effects of wounds. Before we dive into the exciting topic of wound healing and wounds, it is important to first understand the functions of the skin and why they are important. The skin is divided into 3 main layers. The first one is the epidermis, which is the top outermost layer composed of stratified epithelial cells. This is a protective, waterproof, keratinized layer. The second one is the dermis. This consists of elastic connective tissue made up of collagen. This layer includes the nerves, hair follicles, glands, immune cells, and blood vessels. And finally, the subcutaneous layer is the bottommost layer, which anchors the skin to the underlying tissues. It consists of adipose tissue, lobules of fat cells, and connective tissue. Now let's look at why the skin is important. Well, it's important because it plays a lot of major functions. Firstly, protection. It's a barrier to microorganisms, UV rays, infection, injury to underlying tissues and organs, and moisture loss. It helps us with temperature regulation. It draws heat from the sun through perspiration, dissipates heat through vasodilation, prevents heat loss through vasoconstriction, and contraction of pilomotor muscles, which causes our hair to stand and form a layer of air on the body. That's what we refer to as goosebumps. Psychosocial, our external appearance, our identity, the way we communicate. Sensation, sense of touch, pain, pressure, and temperature. These sensory impulses help us to adjust to the environment we are in. It helps us with vitamin D production, which is activated through the UV rays from the sun. Immunologic function, which triggers immunologic responses when our skin is broken. Absorption, it helps us absorb substances. Elimination, it excretes water, electrolytes, and nitrogenous waste through sweating. There are different factors that affect our skin integrity. For example, our state of health. Unbroken and healthy skin and mucous membranes defend against harmful agents. Age. Resistance to injury is affected by age, underlying tissues, and illness. Nutrition. Adequately nourished and hydrated body cells are resistant to injury. Circulation, which is necessary to maintain cell life. Some developmental considerations include children under 2 years. Their skin is thinner and weaker. In infants, their skin and mucous membranes are very sensitive, so they're very easily injured and subject to infection. In increasing age, structure changes, maturation of epidermal cells is prolonged, which leads to thin, easily damaged skin. For older adults, circulation and collagen formation are impaired, leading to decreased elasticity and increased risk for tissue damage from pressure. Now let's move on to wound healing. Phases of wound healing, also known as the cascade of healing. This is the process by which the body sets into motion an automatic sequence of events to repair injured tissue. The first phase is hemostasis. This occurs immediately after injury. It stops bleeding and activates white blood cells to fight bacteria. Blood vessels constrict, clotting begins through platelet activation and clustering. This coagulation causes fibrin clot formation. Fibrinolysis then makes the body release substances that dissolve the clot. Other cells are also stimulated to migrate to the site of injury to start the next phase, which is the inflammatory phase. This lasts 1 to 3 days. White blood cells arrive on the site. Leukocytes ingest bacteria and cellular debris. 24 hours later, macrophages enter the wound, ingest debris, and release growth factors. These growth factors promote epithelialization, formation of new blood vessels, and attract fibroblasts. Fibroblasts fill the wound and start the next phase. Blood vessels dilate, exudate is released. This accumulation of exudate and perfusion cause acute inflammation. Cytokines increase the inflammatory phase to promote healing. Signs and symptoms include elevated temperature, malaise, and leukocytosis. These signs are very similar to those of an infection. Chronic wounds have a delayed inflammatory phase due to healing impediments such as ischemia, necrotic tissue, heavy bacterial loads, high levels of pro-inflammatory enzymes that destroy healing tissue. These substances in chronic wounds are 100 times higher than acute wounds and would require aggressive treatment to repair. The proliferative state, or the repair phase, is the next one. It lasts usually 14 to 21 days, also known as the repair, fibroblastic, regenerative, connective tissue phase. This is where actual healing takes place. It can last several weeks. Fibroblasts synthesize and secrete collagen and produce specialized growth factors, which help in the formation of blood vessels, endothelial cells, and capillaries across the wound. These capillaries bring oxygen and nutrition to the site. Epithelialization and granulation occurs. Scar tissue formation happens, leading to the next phase, which is the maturation and remodeling phase. This can last months to years. It is the final stage and usually starts 3 weeks after injury. Collagen deposits make the wound stronger and similar to the adjacent tissue. Scarring is thinned out. Scar tissue strength, however, always remains at 70 to 80% of that of the uninjured tissue. Wound healing is of 3 types: primary, secondary, tertiary. Primary healing occurs in well-approximated intentional wounds, such as surgical incisions. They have minimal tissue damage, low risk of infection, fast healing, and minimal scarring. Secondary healing occurs in large open wounds. They have increased tissue loss, high risk of infection, longer healing times, form more scar tissue, and can get contaminated. Examples include burns and open wounds from major trauma. Tertiary healing is delayed primary closure. This applies to infected wounds that are left open to resolve the infection, edema, or to drain fluid. After tissue is resolved, they are closed by primary intention. Factors affecting wound healing can range from local, systemic, and nutritional causes. Local factors include pressure, desiccation, maceration, trauma, edema, infection, excessive exudate, necrosis, and biofilm. Systemic factors include age, circulation, oxygenation, nutrition, wound etiology, medications, other therapies, immunosuppression, and non-adherence to treatments. Nutritional issues include protein malnutrition, calorie deficits, uncontrolled glucose monitoring, dehydration, vitamin deficiency, and deficient needs such as protein, glucose, fats, arginine, vitamins, minerals, and copper and iron. One of the main complications of wound is infection. This occurs when the immune system fails to control the growth of microorganisms, leading to chronic wounds, sepsis, or osteomyelitis. Risks include trauma, surgery, contamination, and hospital-acquired infections. Symptoms appear 2 to 7 days after the initial wound develops, and these include purulent drainage, increased drainage, pain, redness, swelling, increased body temperature, increased white blood cell count, and delayed healing. Other complications of wounds include hemorrhages. These can be caused by slipped sutures, dislodged clots, erosion of blood vessels by a foreign object. Interventions include checking the site frequently for the first 48 hours. In case of surgical sites, every 8 hours for the first 48 hours. If excessive bleeding occurs, pressure dressings or packing or even surgical interventions need to be taken. A hematoma is a localized mass of clotted blood caused by internal hemorrhage. Fistula formations. A sinus tract is a narrow passageway extending from a wound underneath the skin in any direction through soft tissue and resulting in a dead space with a potential for abscess formation. These abscesses are collections of infected fluid that have accumulated and not drained, causes pressure on the surrounding tissue leading to a fistula. A fistula, then, is an abnormal passage from an internal organ or vessel to the outside of the body. Risks include delayed healing, additional infection, fluid and electrolyte imbalances, and skin breakdown. Two other very significant wound complications include dehiscence and evisceration. Dehiscence is a partial or total separation of wound layers due to excessive stress on unhealed wounds. Evisceration, on the other hand, is a serious complication of dehiscence when internal organs protrude through the incisional area. Usually occurs in abdominal incisions. Risk factors include obesity, tobacco smoking, malnutrition, anticoagulant use, infected wounds, excessive coughing, vomiting, or straining. Types of wounds. What is a wound? By definition, a wound is a break or disruption in normal integrity of skin and tissues. There are different types. We have intentional or unintentional, neuropathic or vascular, pressure-related, open or closed, acute or chronic, partial thickness or full thickness. The parts of the wound include the wound base, the edge or margin of the wound, the depth of the wound, measured by a Q-tip applicator, the peri-wound, which is about 4 centimeters surrounding the wound edge, any tunneling, or any undermining. Types of wounds. Open wounds. Causes are intentional or unintentional trauma. The skin surface is broken. It has risks for infection, tissue damage, bleeding, delayed healing. Examples include incisions, abrasions, and pressure injuries. Closed wounds can be caused by blow force or trauma. The skin surface is not broken, and there are risks for soft tissue damage, internal injury, and hemorrhage. Examples include hematomas and ecchymosis. Acute and chronic wounds. Acute wounds. These are caused by trauma or surgery. They occur suddenly, wound edges are approximated, they progress through the healing process fast, and have a low infection risk. Risk is still there for an infection though. Examples include incisions. Chronic wounds are caused by delayed healing. Features: skin surface is broken, risk for infection, tissue damage, bleeding, delayed healing. Examples include diabetic foot ulcers. Partial and full thickness wounds. In partial thickness wounds, the damage extends to the epidermis. No subcutaneous tissue is exposed, and they are usually less than 0.2 centimeters in depth. Examples include skin tears, first-degree burns, and stage 2 pressure injuries. Full thickness wounds, the damage extends to the subcutaneous tissue and below. Examples include venous ulcers, full thickness burns, and stage 4 pressure injuries. This is a list of other types of common wounds, including incisions, contusions, abrasions, lacerations, punctures, penetrating wounds, avulsions, chemical wounds, thermal, irradiation, venous ulcers, arterial ulcers, diabetic ulcers, and pressure ulcers. Skin disorders. Skin lesions are of two types. Primary skin lesions, which originate on previously healthy skin, are associated with a specific cause. Secondary skin lesions, on the other hand, develop from a primary lesion due to traumatic manipulation, such as scratching, rubbing, treatments, or progression. Common primary and secondary lesions include cysts, crusts, pustules, ulcers, vesicles, wheals, papule, and macule. Fungal infections. Tinea is a very common fungal infection, also known as the ringworm. These are yeast-like organisms that colonize the skin, GI tract, GU tract, and vagina. Causes include malnutrition, poor hygiene, warm climates, physical contact, immunosuppression, medications, contact sports, and locker room use. The different types are athlete's foot, jock itch, scalp ringworm, body ringworm, and nail infections. The signs and symptoms depend on the type of ringworm. In athlete's foot, there is whitening between the toes, scaling, an itchy rash, and blisters. Jock itch is in the groin area and includes red ring patches, itching, and pain. Scalp ringworm. These have red scaly rashes on the scalp, itching, hair loss, and rash on the body. Nail infections are thickening of the nails and yellowish nails. Body ringworm. These include red circular lesions, lighter in the middle with raised edges, and itching. Treatment includes oral topical antifungals, special shampoos, and steroids. Another common fungal infection is candidiasis. This is a yeast-like organism that colonizes the skin, GI tract, GU tract, and vagina. Physical features include pustules, papules, plaques, crusts with white exudate, satellite lesions, pruritus, burning at the site, and are found usually in the skin folds. Causes include moist, hot, humid environment, diabetes, antibiotic therapy, immunosuppression, and dermatitis. Signs and symptoms include itching, burning, budding spores, and a very key symptom is satellite lesions. Treatment includes reduce the cause, body powders, prevent moisture, and topical antifungals. Bedbugs. These are small, flat, parasitic insects that feed on blood from people and animals. They're reddish brown in color, wingless, and 1 to 7 millimeters big. They can live several months without eating. They're found all over the U.S. They usually live 8 feet within sleeping areas and can travel up to 100 feet at night. During the day, they hide in mattresses, bed frames, headboards, tables, wallpapers, and cluttered objects such as stuffed animals. Health risks include disease, itchy skin, loss of sleep, and serious allergic reactions. Signs and symptoms include bite marks, which can take up to 14 days to show. Bedbug ecoskeletons after molting in mattresses and sheets, rusty colored spots, which are blood-filled fecal matter, sweet, musty odor. Treatment includes antiseptic creams, antihistamines, insecticide sprays, and avoiding scratching. Scabies, also known as the human itch mite. Transmission occurs from prolonged contact with contaminated objects. Crusted scabies is more contagious and usually contains thousands of mites. An infected person can harbor up to 20,000 mites in a small area. Signs and symptoms include pruritus, itching, especially at night, papulovesicular erythematous rash, burrows from mite tunneling, tiny raised grayish-white between fingers and folds, wrists, elbows, knees, breast, and shoulders. In infants, on the head, face, neck, and palm. Symptoms occur 2 to 6 weeks after infestation. When crusted, crusting is visible, scaly, there are a large number of mites, and less itching. Treatment includes permethrin cream, 5%, applied all over the body for 8 to 12 hours. It's washed off and a second application is applied a week later. Treat household members and close contacts. Oral ivermectin, a single dose of 200 units per kg, repeated 1 to 2 weeks. Should not be used for children under 15 kg. Ticks. These are small, blood-feeding parasites associated with rodents. They burrow their mouths in the skin for a blood meal. Bodies enlarge to the amount of blood ingested. They can feed for several minutes to days. They're usually found in low-lying vegetation, grassy, bushy, or wooded areas. Health risks include tick-borne diseases, Lyme disease, Rocky Mountain spotted fever, tick-borne relapsing fever, tick paralysis, and tularemia. Signs and symptoms include fever, chills, aches, pain, rash, tick paralysis, alpha-gal syndrome, low blood pressure, shortness of breath, dizziness, swelling of lips, throat, or tongue. The treatment includes removing the tick, sending it for testing, treating symptoms, and possibly using antibiotics. The procedure for removing the tick includes using a clean, fine-tipped tweezer, grasp as close to the skin as possible, pull upward with steady pressure. Don't twist or jerk or the mouth part could fall off. Put in alcohol, seal the bag, wrap in tape, and flush down the toilet. Managing the psychological effects of wounds is very important. Pain. We manage pain, pharmacologically and non-pharmacologically. Anxiety and fear. Show empathy, encourage expression of feelings, answer questions accurately and honestly, and always remember to maintain dignity. Activities of daily living. This negatively impacts patients physically, financially, and medically. Changes in body image. We can help by identifying goal thinking, assessing adequacy of knowledge, and consulting helpful resources, and, most importantly, avoiding judgments. Educating the patient and caregiver is very important. Some educational points include follow physician orders with wound care and contact healthcare worker if any questions. Wash hands before and after changing a dressing. Wear gloves during all dressing changes. Dispose of the old dressing in a plastic bag before placing it into the garbage. Cleanse the wound before applying a new dressing. The wound can be cleansed by water, saline, or wound cleanser as ordered by the physician. Contact healthcare provider immediately if the patient has fever, chills, increased amount of pain, swelling, or redness, separation of wound edges, change in wound drainage, color, odor, or amount.